This is Chase and Tino, and we had the throwing mechanics, specifically the hand and wrist portion.
So first, the bony anatomy. You have the radius, the ulna, the carpals, which are the scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, and hamate. And then you have the metacarpals, the proximal phalanges, the middle phalanges, and the distal phalanges.
So, anatomical joint-wise, you have the distal radial-ulnar joint, the intercarpal joints, carpo-metacarpal joints, metacarpophalangeal joints, the proximal interphalangeal joints, which is digits 2 through 5, the distal interphalangeal joints, which is also digits 2 through 5, and the interphalangeal joints, which are the thumbs.
So muscular anatomy for the wrist extensors. There's the extensor digitorum, extensor carpi radialis longus, the extensor carpi radialis brevis, extensor carpi ulnaris, extensor indicis, extensor digiti minimi, extensor pollicis longus, and extensor pollicis brevis.
So for the wrist flexor muscular anatomy, there's the flexor digitorum superficialis, the flexor digitorum profundus, flexor carpi radialis and ulnaris, palmaris longus, and flexor pollicis longus.
So some other forearm muscles are the brachioradialis, the pronator teres, the pronator quadratus, and the supinator.
The long muscles of the thumb include the abductor pollicis longus, the extensor pollicis longus and brevis, and the flexor pollicis longus.
And then the short muscles of the thumb, those would be the abductor pollicis brevis, the flexor pollicis brevis, the opponens pollicis, and the adductor pollicis.
So on the medial side of the hand, you have the palmar interossei, dorsal interossei, the hypothenar eminence, which includes the abductor digiti minimi, the flexor digiti minimi brevis, the opponens digiti minimi, and also the lumbricals.
So just to review the throwing stages, there are 6 of them. The first is the windup, the second is the stride phase, the third is cocking. You have early and late cocking. And then the acceleration phase, arm deceleration phase, and then the follow-through phase.
So these are some pictures of the windup phase.
So as far as the windup goes, it is the beginning of the pitcher's movement until the maximal knee height is reached. There is very low injury for the hand and wrist. And then the main motion would be wrist and finger flexion to grip and hold the ball.
So again, here's some pictures of the stride phase.
So for the stride phase, that's when it generates about 50% of the velocity for the pitch or the throw. This is where the pelvis moves towards the plate. This is also low injury for the hand and wrist. They are mostly lower body injuries due to the mechanical issues. And then there is slight pronation of the hand and wrist as well as finger flexion to maintain the grip on the ball.
So here's some pictures of pitchers throughout the cocking phase.
For the cocking phase, that's where there is maximal external rotation of the shoulder, which is how that phase is best defined. And then the forearm pronators and wrist flexors are commonly injured due to the varus torque of the elbow during the phase. And then pronation stays the same throughout. The wrist extends to load the ball back, and then the fingers remain flexed to be able to grip the ball.
Here's some pictures of the acceleration phase.
So for the acceleration phase, this is where the pitcher begins to bring the arm towards the plate. There's low risk of injury for the hand and wrist. There's flexion and pronation of the wrist at 90 degrees, and the fingers are flexed while releasing the ball but extend upon the release.
So here's some pictures of the deceleration phase.
During the deceleration phase, the release point and slowing down of the body after the pitch is how we would define that phase. There's also low injury risk for the hand and wrist during this phase, and the forearm continues to pronate and the fingers begin to extend during this phase.
Finally, you have the follow-through phase.
And this is where the body is rebalanced after the pitch or after the throw. There's also a low injury risk for the hand and wrist during this phase. The forearm supinates to return to the normal anatomical position, and the fingers and wrist flex or extend to comfortably return to their normal positions. And those are our references.